I'm Klein with Patient Care Pharmacy, and I'm here to demonstrate the Accu-Check Multiclix Lancet device. This is an alternative device to other lancing methods, and it's going to replace the Surgilance. It costs the resident $30 for the initial device, which comes in this package, and then it's approximately $10 a month for another 102 Lancets. And the Lancets are 6 in a drum. So you just load and go. There's no Lancets to see or touch, which makes it safer for everyone. So I'm going to demonstrate how to load and how to lance someone for a diabetes check, their blood glucose. These are the drums here. There'll be 102 Lancets total, and the drum has 6 Lancets in each. One very important thing to remember is when you pull the drum out, it's going to have red marks on the side. This would indicate that the drum has been completely used, and you would want to place this in the sharps container along with alcohol swabs and anything else that may be used when you're lancing someone or they're lancing themselves. So you take the drum, as you see here, and you simply press it in. Now when you put it in, you want to remember you can't stop, because you can't pull it back out, because that will render the drum unusable. So you place it all the way in, and you can put your finger over the top. It's not going to, the Lancets aren't going to come out and prick you. So you simply press it in till it clicks. Then you take your cap, and there's a little notch here, and it aligns with the notch on the device. Now you can see that there are 6 Lancets now that are available. So you simply push down by pushing down on this as if you're pressing down to engage one of the Patient Care Pharmacy pens. Press it down like a pen, comes up, and it is now loaded. This yellow button is yellow on the button indicates that it is now ready. So what you want to do is take an alcohol swab. Once you have it ready, take the alcohol swab, open it up, and you want to swab the finger, of course. And it's also probably a good idea to clean the tip of the device. And you want to ensure that it is completely dry before you prick the finger, as it may cause the results to be different. So once it's dry, go ahead and place it to the finger, and you're going to release. You're going to release by pressing on this yellow button that I showed you. And right now it's at 5.5, so I'm going to prick my finger to demonstrate for you. I don't do this often, but for demonstration purposes. So when you're ready, press down on the button. The needle will go into the finger, you place it off, and then you want to work the finger to get some blood, as you can see there. Once you get enough blood for a reading, you want to then you're now ready to test it. So then you want to clean the finger, and you want to clean the device. It's recommended to clean with a 70% isopropyl alcohol solution, which is your typical alcohol prep pad or alcohol swab. So clean the entire outside of the unit after every use. This is what's recommended by Accu-Check and what's recommended for state compliance. And you want to clean the inside and outside of the cap. It's recommended to clean it after every use. You have to take it off carefully, otherwise you may pull out the drum. So go ahead and clean the inside and outside of the cap. You should do it after every use. It is recommended. And if the state officials ask you, you clean it, you should be cleaning it after every use. Full outside of the device and inside and outside of the cap. You can replace the cap after you've cleaned it. Remember to place this in a sharps container or other biohazard waste container. And when you're done, you simply turn it 1/4 ways, clockwise, as so. And this locks it. It can't be pressed down at this time. And it's ready for the next individual who's going to have their blood read. So when the next nurse or med tech comes on, they would simply rotate this now counterclockwise back, as so. The number indicated here on the plunger of the lancet device indicates the number of lancets remaining, which in this case is 3. Meaning 3 lancets have already been used. So the next person simply, when they're ready, simply pushes down on the device, just like one of our patient care pharmacy pens. It's the easiest way to describe it. It is now engaged, and it is ready to be used to land someone's finger. And they simply, again, this is adjustable, and it's recommended to start at the highest setting, and then if needed for comfort, you can turn it down. 5.5 is the highest setting, so that's what's recommended to start at, and this is what Accu-Check recommends themselves. And when you're ready, get your depth. Start at 5.5 if this is the first time, or if it's difficult, someone has callus on their hands, or they're not easily, it's not easy if it's not easy to get blood. And you simply press down. Again, you press down on the yellow button like this. That releases, if you hold it to the finger, that releases it. Make sure you're holding firmly to whichever finger that you're going to use. There's also another cap, which is a clear cap that can be used for alternate site testing. So, but remember, clean the outside of the device after every use, inside, outside the cap. So clean it thoroughly. And if another site want to test on another part of the body, you simply remove this cap and you place on this clear cap that you see here, and that goes right over that, so you can actually see the drum with the clear cap, and that's how it fits in there. And it could be used for testing, say, on the forearm or wherever. It's recommended to test on alternate sites if the fingers are an issue. And you simply remove the clear cap if you're going to and replace the other cap. And as you can see, it's not yellow, so it's not engaged. You can't even press it because we just demonstrated that. So you turn it counterclockwise once you're done. Okay, I'm sorry, turn it clockwise, 1/4 turn. And it is now ready for the next person. Turning it also turns the drum. So it's locked and ready for use by the next person. If you have any other questions, please don't hesitate to contact us here at Patient Care Pharmacy. Thank you very much. Have a great day.